In the healthcare setting, PPE, or personal protective equipment, is integral to preventing the spread of infectious disease. PPE can include masks, gowns, gloves, and eye protection. Your facility will recommend the appropriate PPE for different circumstances based on the level of precautions required. With masking, there are two terms to be aware of: source control and respiratory protection. Everyone secretes respiratory droplets when they talk, cough, or sneeze. Source control protects others from these respiratory secretions by stopping them at the source through the use of masks. Respiratory protection protects the wearer from breathing in air that contains contaminants through the use of a respirator. In addition to source control, surgical masks, often used in healthcare settings, do a good job of blocking particle droplets in the environment from reaching the wearer's mouth and nose. Always follow your facility guidelines to determine what kind of mask you should be wearing for specific tasks. Fit is important. The mask should cover your nose and your mouth and fit snugly against the sides of your face. If you have to adjust your mask often, it doesn't fit you properly. You should never touch your mask while you're wearing it, so make sure the mask you use fits well. Let's talk about putting on or donning your PPE, including masks. Before putting on PPE, be sure to wash your hands thoroughly or use hand sanitizer. As a note, you can refer to our hand washing video for best practices. If your PPE requires a gown, start with that, fastening it behind your neck and at your waist. Next, secure your mask or respirator, making sure the fit is snug. If your task requires goggles or a face shield, these go over your face next. Donning gloves should be the last step. If you're wearing a gown, make sure they are pulled over the wrist cuffs. Removing PPE is called doffing. The outside surfaces of all PPE are contaminated and must be handled as such. If your hands get contaminated during any stage of PPE removal, immediately wash your hands or use alcohol-based hand sanitizer before removing anything else. Doff PPE in the following sequence. Gloves. Using a gloved hand, grasp the palm area of the other gloved hand and peel off the first glove. Hold the removed glove in your gloved hand. Slide the fingers of your ungloved hand under the remaining glove at the wrist and peel off the second glove, pulling it over the first. Discard gloves in a waste container. Next, remove your goggles or your face shield from the back by lifting the headband or earpieces. If the item is reusable, place it in a designated receptacle for reprocessing. Otherwise, discard it in a waste container. Gown. Unfasten the gown ties, taking care that the sleeves don't contact your body when reaching for ties. Pull the gown down away from your neck and shoulders, touching the inside of the gown only. Turn the gown inside out, fold or roll it into a bundle, and discard. Finally, remove your mask. Carefully untie the strings behind your head or stretch the ear loops. Handle only the ear loops or ties. Don't touch the mask itself. Fold the outside corners of the mask together and discard in a waste container if soiled. Be very careful not to touch your eyes, nose, or mouth when removing PPE, and always wash your hands immediately after PPE removal.